This amendment addresses mass layoffs at the CDC, would prevent implementation of further layoffs or similar actions that would result in cuts to over 3% of the agency's employees within a 60-day period. And before I go any further, I do want to take a quick point of personal privilege to wish my daughter Samantha a happy 10th birthday today. And that's because we both almost died when she was born by emergency C-section after my placenta ruptured. And that experience furthered my commitment to addressing the horrendous maternal mortality crisis in this country. And that led me to further understand the intersection between substance use disorder and maternal mortality. Now, thanks to CDC data and analysis relied upon by the Virginia Department of Health, specifically from the Pregnancy Risk Assessment Monitoring System, or PRAMS, I came to understand that the underlying causes of maternal death, many of which are preventable. An accidental overdose is a leading cause of pregnancy-associated death and is the leading cause of death for white women in Virginia for pregnancy-associated deaths. But now the entire PRAMS team is gone as part of the cuts to nearly 1/4 of the workforce announced earlier this month by Secretary Kennedy at the Department of Health and Human Services. The PRAMS team was part of the 2,400 employees cut at the CDC. And a recently leaked HHS budget document indicates that CDC funding could be further cut by over 40% on top of these firings. And the devastating impacts of these cuts have become clear as the CDC divisions not only support addressing the maternal mortality crisis and the substance abuse crisis, but workforce safety, injury prevention, HIV, and more. Now, following Secretary Kennedy's announcement, I introduced a bill to prevent these reckless workforce cuts at HHS. And that's because I find it unfathomable and deeply hypocritical for the Trump administration to claim that it wants to make Americans healthier and safer while dismantling the very agencies, workforce, and programs that do that. I'm perplexed that we are authorizing public health programs here today, as critically important as much as I support them, and yet my colleagues on the other side of the aisle have remained silent about the firing of the very staff needed to carry them out. So this amendment would prevent the CDC from implementing further mass layoffs. Now, in addition to its critical role in addressing the maternal mortality crisis, the CDC provides critical public health information, including on substance abuse disorders. It monitors trends to better understand and respond to the epidemic, advances research by collecting and analyzing data on opioid overdoses, improves data quality to better identify areas that need assistance, and to evaluate prevention efforts through the Division of Overdose Prevention. That's on top of all of the other critically important roles the CDC plays, protecting Americans from infectious diseases, and et cetera. Now, it's clear that Secretary Kennedy, Elon Musk, and DOJ don't understand how the CDC or any of our agencies function, the critical role they play in addressing the interconnected crises like maternal mortality and the opioid crisis, the critically important partnership they provide to our state, local, nonprofit, public, and community-based health systems. And these attacks on the CDC's workforce have severe long-term consequences. They are not only destroying today's workforce, they are damaging the pipeline for the next generation of public health professionals. This is not leadership. This is not making Americans healthier again. And on this day that I am reminded of how fragile life is for pregnant and postpartum women, I ask that you support this amendment to help stop the gutting of critically important partners to ensuring we address the intersection between maternal mortality and the opioid crisis. Thank you, and I yield back.